Now, the last time the world was hit by a pandemic of similar nature was nearly a century ago in 1918. It took about 2 years before H1N1 was defeated. This time around, the World Health Organization hopes that in less than 2 years, COVID-19 can be contained. Here's a report on how.
A 100 years ago, there had been a pandemic, a flu that had ravaged the world. It affected nearly 1 in every 3 people in the world. 500 million people were infected and 50 million died. In India, the toll was estimated to be 12 to 13 million. There was no vaccine and the first antibiotic was 10 years in the future. So the flu pandemic that began in 1918 carried on till 1920 before it subsided. With limited connectivity compared to 2020, isolation, quarantine, good personal hygiene, use of disinfectants and limitations of public gatherings helped control the pandemic to the extent possible till finally that virus had been defeated.
Of course, with more connectedness, the virus has better chance of spreading. It can move fast because we are more connected now. But at the same time, we have also the technology to stop it and the knowledge to stop it. So we have a disadvantage of globalization, closeness, connectedness.
Lockdowns, quarantine, masks, PPE kits, sanitizers and social distancing became part of daily lives and vocabulary across the world. And with that too was the inevitable question, where's the vaccine that can stop this virus? And so began the race for a vaccine, a weapon to fight the deadly virus to end the pandemic at the earliest, and to also reap the commercial benefit that the first successful vaccine would deliver.
So we hope to finish this pandemic before less than 2 years, especially if we can pull our efforts together and with national unity, global solidarity. That's really key, with utilizing the available tools to the maximum and hoping that we can have additional tools like vaccine. I think we can finish it in a shorter time than the 1918 flu.
While it is understood that the vaccine would come from one of the more developed countries, what about its equitable and affordable distribution across the world? To address this legitimate concern of the global south, WHO initiated the COVAX facility, a 172-country grouping that would participate in the fair distribution of the vaccine as per the need of humanity, rather than the concern for commerce and profit.
Last week, I sent a letter to all member states requesting them to join the vaccine arm of the ACT Accelerator. I'm pleased to announce that as of today, 172 countries are now engaging with the COVAX Global Vaccines Facility, which has both the largest and most diverse COVID-19 vaccine portfolio in the world. At present, there are 9 vaccines that are part of this dynamic portfolio, which is constantly being reviewed and optimized to ensure access to the best possible range of products. Even now, discussions are ongoing with 4 more producers, and a further 9 vaccines are currently under evaluation for the longer term.
COVAX currently has 9 candidate COVID-19 vaccines, and the aim of the initiative is to deliver 2 billion vaccine doses across the countries that sign up. The deadline for joining is 31st of August 2020.